Hi, my name is Kelly Santarosa. I'm a Senior Policy Analyst with AUMA. I'd like to welcome you all to the second webinar in our Alberta Nutrition Report Card series. So today in the webinar we're going to talk about how economic, social, and political environments can influence healthy eating. And our speakers today are Michelle Louie and Krista Milford. So I'll turn things over to Michelle.
Great, thanks Kelly. So welcome everyone to the webinar. So today we'll be looking at what role municipalities can play in supporting healthy food choices. So we'll give you a little bit of an introduction and background to food environments, nutrition, and how policies can affect these food environments. Then we'll introduce the Alberta Nutrition Report Card on food environments for children and youth, explain the grading system for the report card, and then talk specifically about the economic, social, and political environments and what we looked at in those areas. We'll also give you some tools and resources that you can use to act on the recommendations that we provide. And then finally, we'll discuss some quick wins for municipalities, some mid-range solutions, and then some long-term goals that you can work towards to improve food environments in your municipality. So just starting off with a little bit of a background, according to Statistics Canada, in Alberta, about 26% of children and youth have overweight or obesity. And we know that obesity and its associated chronic diseases, such as heart disease, high blood pressure, and type 2 diabetes, are all a major public health concern in Canada. In the past, obesity-related chronic diseases were typically only seen in older adults, but these diseases are becoming quite a bit more common in children. And one of the main concerns with this is that children who have obesity are more likely to maintain an unhealthy body weight into adulthood. And so it's important to promote healthy weights amongst children. Given the enormous cost to individual health as well as high healthcare costs associated with treating obesity, there's clearly a focus needs to be placed on prevention of obesity and other chronic diseases. And current policies and actions can act as barriers or facilitators to positive change, ensuring that healthy food is encouraged and available for people to eat and access. So it's well established that healthy eating can prevent childhood obesity and chronic disease. We know that increasing prevention efforts to fend off obesity in early life is critical because eating habits are often sustained into adulthood, and so we want to ensure that children are developing positive eating habits in their youth. And one thing that's really important to note is that healthy eating is more than an individual choice. It's influenced by the environments in which we live. So looking at the community nutrition environment, that's defined by the number, type, location, and accessibility of food stores, and it influences individuals' food choices for better or for worse. So if you live in a community with predominantly unhealthy food stores, this has been found to increase consumption of unhealthy foods because these items are more accessible and are more heavily promoted. So this slide is outlining results from the 2015 Global Burden of Disease Study. This is an international research program that assesses mortality and disability from major diseases and risk factors. So looking at the top bar in the graph, that represents the deaths attributable to dietary risks. And you can see that this is the most significant risk factor for death in Canada. It's even taken over tobacco, alcohol, and drug use, which are typically seen as extremely harmful to our health. And so this really just highlights how important healthy eating is for managing chronic disease and death. So now I'll pass it over to Krista to talk about the report card.
Great, thanks, Michelle. So when we look at, oops, hit that too far forward. The nutrition report card I'm going to go over, what is it? And it was actually inspired by the Participation Physical Activity Report Card, which is a national report card. And so the nutrition report card is just for Alberta. It's at the provincial level currently, with hopes to extend out nationally later. And we're applying the concept of benchmarking food and nutrition policies. And what benchmarking is a way to gauge the policy related to healthy eating with hopes to generate stronger government policies and actions. And there's a number of groups that are kind of looking at benchmarking. One of them is called Informas, and it has a very long name, but it's the International Network for Food and Obesity Non-Communicable Disease Research, Monitoring and Action Support. And they've outlined the nourishing framework to monitor benchmarks relevant to the food environments. And that's what we use to create the indicators and the benchmarks in the Nutrition Report Card. Also, Brennan and et al. Provided a comprehensive overview of policy and environmental strategies to reduce obesity and improve children and youth health-related behaviors. And we also incorporated this into the Nutrition Report Card. So this conceptual framework then depicts how policies and environments interact to shape children's health-related behaviors and body weights. So in the Nutrition Report Card, we cover 5 environments: physical, communication, economic, and social, all encompassed by the political environment, which forms the structure of the Nutrition Report Card. And we typically focus on major settings that have greatest relevance to children and youth, so school, childcare, and in community settings. So the Nutrition Report Card is an annual assessment. We've conducted 4 annual assessments so far, and we just recently launched the 2018 Nutrition Report Card on September 20th. And so this assessment is looking at how Alberta's current food environments and nutrition policies support or create barriers to improving children's eating behaviors and body weights. Through this assessment, we're hoping to increase public, practitioner, policymaker awareness of the relevance and the status of food environments for children and youth, with a focus on health promotion and obesity prevention. So we're hoping that it would serve as a tool for all levels of government, non-government organizations, researchers, corporations, and foundations to support and develop enhanced programming and policies, as well as to identify areas that require further action. And this next slide just shows the 5 food environments. So looking at the first one, physical, it's really looking at what's available, and it could be in a variety of food outlets like restaurants, grocery stores, vending machines, in buildings, schools, work sites, community, sports, and arts venues. The communication environment is looking at what food-related messages are influencing children, so anything from food marketing, as well as at the point of purchase, the information in the food retail settings, such as nutrition labels, as well as nutrition education that they receive in school. Then the economic environment is looking at what are the financial influences that relate to the cost of purchasing food. So that's typically determined by market forces, but also public health interventions such as monetary incentives and disincentives in the form of taxes, pricing policies, and subsidies, and financial support for health promotion programs and healthy food purchasing practices can all affect food choice. Then the fourth environment pardon me, is the social environment. That's the attitudes, beliefs, and values of a community or society. It refers to the culture, ethos, or the climate of the setting, and it includes social responsibility, health-promoting behaviors of role models, and values placed on nutrition in organizations, and then the relationships between members of a shared setting. All of these are encompassed by the political environment, which is that broader context which can provide infrastructure for those policies and actions within the aforementioned environments. Now, looking at the Nutrition Report Card, if you have it there, it's really kind of going from a top-down with the broadest elements of the environment to the more specific ones. So we have those 5 food environments I just described. Then we have within each of those categories, and there are indicators also which are specific areas where actions and policies will be assessed. And then each indicator also has a benchmark, and that's kind of our gold standard. What are the best policies and actions to increase the healthy eating and availability of food in these areas? And for example, within the physical environment, we look at food available within the school, and we want to see that there's a high availability of healthy food, with the benchmark stating approximately 3/4 of the foods available in schools are healthy. So each indicator is graded based on the degree to which that benchmark is met. And we do this every year with our expert working group. And so we gather the relevant information in Alberta, which is readily available from studies or different reports that we gather from non-governmental organizations. And those indicators, all 37 of them, are graded each year. Now, when we look at our grading rubric, we kind of ask some basic questions about, was this benchmark met? Yes. And so if it was, then immediately there's an A, somewhat, not at all, or if there's no data, there's an incomplete. And is there a policy or systemic program in place? And then whether or not it was mandatory or voluntary also affects the grade. So the grades are from A to F. Once each expert working group member grades based on the data that's available for that year, then we compile all that, and then we meet to have a consensus on that grading. So if there's kind of differences in the way the grades are, then we discuss that and figure out what that's based on, and then come to a consensus, and then that's kind of how we generate the grades for every environment, category, and indicator with an overall grade for Alberta. So what grade did we get? So we received a C again. So really it's been fairly consistent over time at a C, and that fluctuates for different reasons. For example, in 2016 there was some funding lost, and so that really negatively impacted our grading that year. And so it really is showing us that we have room for improvement in our policies for food environments. Our focus this year is on municipalities, and we created this infographic to kind of show the 15 indicators that we focused on this year out of the 37. So even though we graded all 37, we chose just to kind of zero in on these ones, as we felt they are most relevant to municipalities. And so this one shows kind of the different settings that the indicators are in, and also shows recommended opportunities for action within each setting, and that's what I'm going to go into a little bit more detail next. So within the Alberta's overall economic environment, it received a D. And looking at the indicator 18, higher prices for unhealthy food, it received an F, since Alberta has no formal policies to promote healthy eating using tax credits. So in the fall of 2017, the Finance Department of the federal Liberal government quietly tested Canadians' thoughts on the idea of a sugar-sweetened beverage tax, and it was reported that many of the participants in the focus groups actually were in favor of this tax because they recognized the current obesity epidemic as well as the potential to reduce costs on the healthcare system. So what we're looking at now is how do we, we're recommending, how do we ask the federal government to implement such a tax? And on February 10th, city councillors in St. Albert unanimously took a stand in asking the federal government to implement a sugar-sweetened beverage tax. And that motion was put forward by a city councillor, and they cited University of Waterloo Health and Economic Impacts of Sugary Drinks in Canada, the study, which did point to estimates of over the next 25 years, a 20% tax would actually postpone 1,200 deaths in Alberta and avert 46,200 disability-adjusted life years. So this research is really showing how that tax could actually prevent almost 61,300 cases of overweight and obesity, as well as 21,700 cases of type 2 diabetes, 5,700 cases of ischemic heart disease, and 2,100 cases of cancer, and 750 stroke cases. So really applying this broad-based policy intervention could create an environment where drinking water or healthier beverages becomes an easier choice for individuals, and the price of purchasing sugar-sweetened beverages then becomes more of a barrier to consumption. So similarly, we are recommending that municipalities can ask the federal government to implement such a sugar-sweetened beverage tax. Moving on to indicator 19, affordable prices for healthy foods in rural, remote, or northern areas received a grade of D+. Since there are no provincial incentives to increase the availability and affordability of nutritious foods in rural, remote, and northern areas, but we did give it a grade because Nutrition North Canada does serve one community in Alberta, which is focused on them being so remote. So we did give that as a bit of a grade there. But yeah, currently Alberta has nothing in place. So what we recommend then is that subsidies directly to the consumers to increase the affordability of healthy food in those areas. And we're suggesting that perhaps municipalities could use transportation dollars to subsidize the transport of healthy food into those areas and potentially liaise with local agricultural producers and local retailers to find cost-effective ways of subsidizing healthy foods, or even funding horticultural activities to grow food locally through greenhouses or fishing or things that would be able to be a viable business in the area. Next, pardon me, we're looking at indicator 24, which is subsidized fruit and vegetable subscription programs in schools, with the benchmark children in elementary schools receive a free or subsidized fruit or vegetable each day. So this one received a C+, and it's largely based on the Alberta School Nutrition Program being in existence, which does reach out to 30,000 students. And so that translates into approximately 4% of all Albertan students. And then if we strictly look at K to 6, it's reaching about 7.5% of that population. So there's definitely potential for more students to benefit. But we are pleased that it's there. And so what our recommendations would be is to provide, to develop more province-wide strategies and also to commit sustainable government funding to this program. And we encourage municipalities to think of creative ways, maybe perhaps even partnering with local farmers markets to provide schools with potentially weekly vouchers for free fruit and vegetables, and to maybe combine that with, say, like a reading program that fits in with the school. So there's different ways of maybe partnering with that program. Now going over to the social environment, Alberta's overall social environment received a C this year. Looking at indicator 27, breastfeeding is supported in public buildings received a B, as we do have the Alberta Human Rights Act, which protects women from discrimination while breastfeeding in public places. And so we do see some evidence of municipalities publicizing that breastfeeding is permitted in their public buildings. So on the City of Edmonton's website, they actually do indicate that breastfeeding is acceptable in all City of Edmonton recreation facilities, and women may breastfeed where they feel most comfortable, or if a woman wishes to breastfeed in private, then staff will assist her in finding space. So when we see evidence like this on websites, we know that there are people that are making that known, and that's what we want to kind of see happening in those environments. So working closely with recreation facilities, municipalities could ensure that they facilitate breastfeeding in all public buildings by going through the assessment checklist. And so there's the assessment checklist created to look at tangible ways to support that. And Michelle will go into more detail on this later. Now looking at indicator 28, breastfeeding is supported in hospitals. It received, as we know that Alberta Health Services strategies align with many elements of the baby-friendly initiative and the 10 steps. So that's on this next slide. There's the 10 steps there, and that's based on the World Health Organization's recommendations. And so what we do, our policy recommendation for that is to actually just recommend that those policies become mandatory across Alberta. So there's still a bit of room for improvement there. And then also looking at working closely with hospitals, municipalities can ensure that they foster a supportive breastfeeding culture in hospitals as well as a community culture where breastfeeding is normalized. Moving on to the next environment, which is the political environment. Alberta's overall environment received a C. And when we look specifically at indicator 30, this is health in all policies, it received a C. And that's because Alberta has not incorporated the health impact assessments in all government departments with policies that have the potential to impact child health. And we know from Alberta's 2015-2016 annual health report that a health in all policy and the analysis process and toolkit were developed to encourage policymakers of the Government of Alberta to consider the social determinants of health when they develop or evaluate public policy. So this process was designed to support Government of Alberta policy practitioners in considering the social, physical, and economic environments and conditions, very similar to our report card environments, when they're developing public policy. So that whole toolkit has actually been piloted and introduced to policy practitioners through sessions, and it's now available upon request to support government employees, but it hasn't been implemented in a mandatory kind of way. So when we're looking at recommendations for this one, we're looking at municipalities could potentially add a health lens to municipal decision making by utilizing the Health in All Policies Analysis Toolkit developed by Alberta Health. Now, when we looked for this toolkit, it's only currently available to Government of Alberta policy practitioners. However, once this has been reviewed and considered carefully, they are considering to make it available to other user groups. So there is potential to actually get this toolkit to use to start to evaluate how will this policy impact different areas of the community's health or the municipality's health. And in terms of a policy role model, in Quebec, they have actually institutionalized health in all policies on a legal basis, and they've incorporated under Section 54 of their Public Health Act. So all government departments and agencies must ensure that their laws and regulations do not have a significant negative impact on the health of populations. So, and there's other examples that we can touch on later in our webinar about this as well. Now moving to indicator 32, compliance monitoring of policies and actions to improve children's eating behaviors and body weights received a C. So at this time, Alberta does not have mandatory school nutrition policies or a provincial monitoring system in place to track that adherence. However, there are steps towards monitoring, and one of these steps that we see is with the Alberta School Nutrition Program, which requires their participating schools to submit a detailed proposal to Alberta Education to show plans introducing or expanding their existing school nutrition program, and in particular how that nutrition program adheres to the Alberta Nutrition Guidelines for Children and Youth. And so they are to provide ongoing updates regarding their activities and submit that twice a year. So it's really unclear at this point what is actually done with that collected information. But there are some indications lately that there might be someone that's actually evaluating that, perhaps like a registered dietitian. So we are hopeful that that will be more closely monitored. And according to our policy scan that was conducted in February 2017, 66% of public, private, and francophone school boards in Alberta, which really represents the majority of schools in Alberta, had designated nutrition, healthy eating policies in place. However, once again, it's unclear, have these policies actually been implemented and to what degree. So our recommendation for municipalities is to work closely with the local school boards and kind of suggest that there's monitoring in place and looking at adherence to these food policies in relation to the Alberta Nutrition Guidelines. And now I'll hand it over back to Michelle to talk about some of the tools and resources that we have available to us.
Thanks, Krista. So just to note, all of the resources and tools that I'll be discussing in the webinar today are available on the Municipal Resource Hub for Healthy Food Policies, and that's located on the AUMA website under Advocacy Services and then Programs and Initiatives. And the link is also at the bottom of the slide. So the first tool first policy I wanted to highlight is Affordable Food in Remote Manitoba, or the AFFIRM program. So AFFIRM is a Manitoba program that reduces the price of fresh foods in eligible remote northern communities using a subsidy. So this subsidy is provided to participating stores, and each store is then required to pass on the full subsidy to the customers. It's available for milk products, fruits, and vegetables, and the discount is determined based on the weight of the food that is purchased. So although this is a provincial program in Manitoba, we're hoping that potentially smaller communities that have high food costs could work with their local grocery and corner stores to offer subsidies on produce and milk products, and then to pass these savings on to the customers. And we hope that this would encourage people to purchase more of these foods that might not otherwise be affordable or accessible to them. So the next tool I'm going to look at is a toolkit on breastfeeding support in municipal buildings. The tool provides suggestions and steps to help make your municipality more breastfeeding friendly. I just want to note that the aim of the tool is not to advocate for breastfeeding per se, but just to make environments more welcoming for nursing mothers and to facilitate the practice of breastfeeding anytime, anywhere. So looking at the steps that your municipality can take, the first one would be to pass a resolution to assert your municipality's will to support breastfeeding mothers. There is a model resolution in this toolkit that you can use for wording or as a starting point for developing your plan. The second step is to take action on your premises to ensure that feeding mothers feel safe. So this could include things like having breastfeeding rooms or breastfeeding signs up. And the blue and white sign in the middle of the slide is the International Breastfeeding symbol. And so when this sign is placed around your premises, it sends a message that breastfeeding is acceptable and accepted, and it also contributes to the protection of breastfeeding in other public areas. The third step is to inform the population and municipal employees about the policies and resolution. The fourth step is to support community initiatives that promote breastfeeding in public. So you could do this by publicizing their activities or providing resources to them. And then finally, the last step is to make a commitment as an employer. So this could be things like having a fridge that's designated for breast milk storage, allowing employees to take breaks to breastfeed without being penalized, and posting signs to inform other employees of the importance of supporting nursing mothers. So there's lots of great tips and suggestions in this toolkit that you can use either as a whole process or take pieces of them to help promote breastfeeding. There's also a checklist to evaluate breastfeeding support in municipal facilities on the AUMA Hub. So it looks at three areas: physical facilities, policies, and the environment. So the physical facilities look at things like having a safe, secure, well-lit, and comfortable breastfeeding room, whether there are breast milk storage facilities, and whether there are breast milk pumping devices available for mothers to use. Policies that support breastfeeding include maternity and paternity leave, having a written breastfeeding policy, and having a flexible work schedule for breastfeeding mothers that would allow them to breastfeed while they're at work. And your environment can be breastfeeding friendly by publicizing support policies or breastfeeding facilities. You can also have signs to promote a culture of breastfeeding, and all departments within the municipality should provide the same accommodations for breastfeeding. So the checklist can also be used to generate ideas of how to make your facilities more supportive for breastfeeding mothers. And the checklist and previous toolkit that I mentioned are quite complementary, and we recommend that they be used together. So the Alberta Policy Coalition for Chronic Disease Prevention has written up a number of stories on healthy policy change in jurisdictions across Canada and around the world. So there are stories on sugar-sweetened beverage taxes, municipal food and beverage policies, municipal zoning, menu labeling, promoting healthy food environments in recreation facilities, and more. And so all of these stories are available on the Hub and on the Policy Coalition website. But I'm just going to highlight two stories today. So the first one is a story about St. Albert's efforts to create healthy food environments in recreational facilities by strategically redeveloping their vending machine and concession stand requests for proposals. So the story starts off when the business and marketing manager for St. Albert's recreation centers noticed that many of the rec centers in the city offered unhealthy food and beverages that were full of fat, sugar, and salt. So he decided to use requests for proposals to promote healthier food options in these facilities. The request for proposals required that potential vending machine vendors submit menus that were comprised of 80% choose sometimes items, 20% choose most often items, and had no choose least often items. So these are according to the Alberta Nutrition guidelines for children and youth. And in addition to vending machines, the city also decided to privatize their concession stands in city rec centers, and they issued healthy requests for proposals for these locations. And the menus, or the requirements for the menus in these locations were based on where the concession stands were located. So, for example, stands that were closer to vulnerable populations had to offer more healthy foods so that these foods were accessible to these groups. So once the vendors were chosen for both the vending machines and the concession stands, the city worked with the businesses during implementation to help ensure that they were able to get everything off the ground. So for example, if businesses were concerned about losing revenue, the city would work together with them to identify ways to make the partnership more profitable. So this could be things like licensing more vending machines for their centers. They also had a city staff member visit all the facilities in person and to assist with implementation of the menus. So after this implementation was completed, St. Albert did see reduced expenses and generated revenue for the city from the privatized concession stands. And they also saw a stabilization of vending machine profits compared to a previous decline in profits. And so this has been, this request for proposals was quite successful in St. Albert. And one of the key aspects which led to success in this story was that there was quite significant public and city council support for the initiative. St. Albert, they mentioned they traditionally support health and wellness initiatives, and the project was marketed as the right thing to do, and it was both financially and nutritionally healthy. So the next story I will be covering is about Hamilton's food and beverage policy. So the aim of this policy is to demonstrate the city's commitment to healthy eating by being a community role model for food service that is free of industrially produced trans fats, and by promoting a safe and sustainable local food system. So this policy applies to all city buildings and public events where the City of Hamilton offers and funds foods and beverages. And so this includes things like food and beverages offered at city staff functions, to vending machines, and concession stands within city rec facilities. So the policy took many years to develop and implement. It initially started out with a pilot test in the Department of Public Health Services for the city for the first 2 years. And this pilot test really helped the city to understand barriers to policy change and also helped them develop strategies to implement the policy across all departments in the city. And even once the policy was fully adopted, the story of policy change was far from over. So the actual implementation was straightforward for some groups within the city. such as those offering food during staff functions. However, for other groups, it was far more complex, such as those who operated concession stands or had to change their menus. So over the years, departments have continued to make changes with the help of policy support, such as dietitians to provide assistance with developing menus and educational workshops. Having high-level champions for the policy has also helped show that the city is serious about healthy eating, and this has helped to change the culture of food for all departments. So this story highlights Hamilton's policy process and provides insights from the city's experience facilitating healthier food environments through policy. It also provides key lessons that can be useful for other municipalities who are going through the same process of policy change. So as I mentioned, these two stories and many others can be found on the AUMA Hub for under Stories of Healthy Policy Change. So here we have the Alberta Healthy Communities Hub, which supports communities on their journey towards building supportive, health-promoting environments. The Hub aims to connect people, organizations, and communities, share evidence-based resources and strategies, provide tools and ideas to help you work, and share community stories and experiences. So there are sections for multiple risk factors for health, including healthy eating, physical activity, UV protection, cancer screening, mental health, and tobacco and alcohol reduction. And each risk factor is broken down into 4 environments in the same way that the nutrition report card is broken down. So under the healthy eating section, you can find resources to develop policies and programs to promote healthy food and beverage choices, tips for creating communication and awareness campaigns to support healthy eating, and information about monitoring the affordability of food and using price incentives to encourage healthy eating. There's also lots of tips and examples from jurisdictions across Alberta to help you as you create your plans for creating healthy food environments. The last tool I wanted to highlight is the Policy Readiness tool. You may be familiar with it as we've highlighted it in AUMA webinars in the past. And so this tool is an evidence-based tool to help communities understand their level of readiness for policy change. So it can be applied to a range of policy topics, including all of the strategies that we've highlighted over this webinar series. And it can be used by a diverse range of stakeholders such as policy developers, advocates, community organizations, nonprofits, and governments to help guide you in your policy work. Its intent is to make participating in policy change more accessible to both experts and non-experts. And it was developed by Dr. Candice Nikiforuk at the School of Public Health at the U of A in partnership with the Alberta Policy Coalition for Chronic Disease Prevention. So what exactly is the Policy Readiness tool? It's a simple self-administered tool that helps users to assess an organization's readiness for policy change. So you can take the questionnaire that's shown on the screen to help determine if your municipality or group is an innovator, majority type, or late adopter. And this is kind of similar to an online or magazine quiz that you might be familiar with. So innovators are described as adventurous and often serve as initiators or role models within their social networks. Majorities are described as deliberate because they require time to consider the evidence and determine whether or not they want to adopt a new policy. And late adopters are described as traditional. They may be skeptical of new ideas without substantial evidence, or they may be eager to maintain the status quo. So using this questionnaire, you can determine your level of readiness, and then once you know that, the tool provides evidence-based policy change strategies for taking action at each level. For example, strategies to use with an innovator include framing the issue to appeal to the innovative spirit and building relationships with key champions. The tool also provides general strategies and resources for all levels of readiness. So we know that navigating the policy sphere can be daunting and complex, especially for non-experts. So it's important to understand your level of readiness for policy change before you work with a community or organization to implement a new policy. So we just want to summarize some of our recommendations from over the webinar series for you. So we'll be looking at quick wins, which require minimal work and are quite quick to implement. Mid-range, which require a little bit more time and work, and then some longer-term goals that would potentially have more of an impact but might take a little bit more effort to achieve. So starting off with the quick wins, there's a creative opportunity to assist schools in meeting the recommendations that we've outlined by having rec facilities provide access to their facilities so that schools can use them to prep food, either for the school nutrition programs or for food skills courses. And this could be quite helpful if schools are lacking this infrastructure and don't have the funds or capacity to develop it. And of course, it's easier if rec centers or schools are already in a close proximity or partnership with each other. We also encourage the use of readily available nutrition education resources from Alberta Health Services to promote healthy eating in local settings, so public buildings, health centers, recreation centers. And one resource that we highlighted at the last webinar is the Healthy Vending Toolkit. So you can start by implementing some of the tips, such as moving healthier choices into line of sight and moving unhealthy choices to the bottom of the vending machine. And you can slowly integrate more healthy choices into the vending machines, and then finally putting up posters to promote healthy eating. And these are all quick and easy things that you can do to help promote healthy eating in your public buildings. The next quick win is to partner with local media to promote healthy eating. So for example, having PSAs or call-ins to talk to a dietitian. Printing and putting up international breastfeeding symbol in your buildings and going through the assessment checklist that I outlined earlier in the webinar can help you figure out how to support breastfeeding in your building. And then creating a resolution to make your municipality more breastfeeding friendly. And the last quick win is to have municipalities ask the federal government to implement a sugar-sweetened beverage tax. So for example, someone could bring this up in council and then write a letter to send to the federal government outlining your support.
And I'll just cover some of the mid-range kind of wins, I guess. So really encouraging municipalities to engage with local dietitians in working with businesses to identify healthy choices on menus. So this may require a little bit more time and relationship building with those local businesses, and also just kind of engaging with local dietitians to kind of work towards identifying these healthy choices for people. A second one is if municipalities are working with school boards to suggest that home economics be made mandatory for junior high students. And we talked about this in part one of our webinar, but really looking at food skills as being an important aspect of the curriculum, which in many schools across Alberta it is available, but it's not mandatory. And so that's the difference, and kind of suggesting that we think is something that could be achievable in a mid-range time frame, as well as municipalities encouraging local farmers markets to provide school children with weekly vouchers for free fruit and or vegetables, and then combining that with school reading programs or other things that are happening in school, and maybe even working with the local grocers to also help with the free fruit or vegetable nutrition programs. So again, these things require a bit more time and relationship building, but definitely well worth working towards. And then finally, encouraging the monitoring of that food policy adherence. Like today I mentioned that there's a large majority of schools that do have a healthy eating policy, but we don't know how well it's being followed in relation to the Alberta Nutrition Guidelines for Children and Youth. And so we recommend really using the developed tools that already exist, like the menu checklist perhaps, to really monitor, is this adherence happening? And it's a way to kind of use what's available and already previously developed tool by Alberta Health Services on their website. So there's the menu checklist, there's the food vending checklist, and there's even special lunch day ideas be used as well. Then looking at more of the long-range goals, considering things like tax incentives for entrepreneurs with innovative ways of offering healthy foods might be something to consider, as well as the healthfulness of products offered when providing licenses to things like food trucks. And then thirdly, looking at municipalities' use of their authority to make changes in zoning policies to improve food environments. And we know that this takes a substantial amount of time and planning. But for example, when a grocery store closes down, municipalities can prevent covenants from restricting future grocery store potential, as well as when fast food restaurants within that 500 meters of schools, when those close down, municipalities could decide what type of food vendor sets up shop next there. And thirdly, as new proposals come forward for land use, municipalities can consider a bylaw that restricts unhealthy food vendors within that 500-meter range of schools. And then finally, taking a stance to ensure no marketing of unhealthy foods and beverages exists in public buildings, close to schools and in daycares. So, what kind of resources, is it billboards within the municipalities, or what other ways that you could be proactive locally to ensure that your community is providing a safe and commercial-free setting for children. So now we'd like to kind of engage the audience, and last time we actually ended up having quite an interesting discussion, and we really enjoyed hearing your comments back. And so we're just wondering if you have any kind of questions to start, and also, maybe just thinking about, these ideas, do they seem feasible in your municipality? Why or why not?
Quiet group at the moment. If you've been holding back, now is the time to put in your question or comment. Okay, we have a comment from Tina. The City of Airdrie is in the process of becoming the pilot community for the Blue Zone project in Canada. We will be working towards many new policies and initiatives similar to this in the future. Now, I think I've heard of the Blue Zone project. You guys?
Yeah, is that with water?
I think it's more about a healthy, livable community. I think I talked to the Mayor of Airdrie about this. It's encouraging health, I think. Let me do a quick Google search, and then we'll find out, and we can tell you guys for sure. Okay, so it's basically looking worldwide at places that have longevity, and based on what those places have in common, moving naturally, plant-based diets, 80% rule, wine at 5, I like that one. Yeah, okay, that's cool. So yeah, if you guys Google Blue Zone project, there's more information about that. And I remember hearing that Airdrie was going to be doing that, so that's really cool, and it sounds like that will align really well with having healthy food policies in your community.
Yeah, it'd be interesting to hear more about kind of any tools that they have through this program. It sounds like it's quite a substantial program, so there might be more ways to look at developing policies or implementing different things through this, and it's great to hear that others are kind of thinking of this. Thank you.
So? Sorry, Melissa, I don't know if you maybe pressed enter too quickly. It just came up as zone. I think no, she's still in there.
Yeah, it just says zone, so maybe there was a question. Oh.
Okay, so Tina, the sugar-sweetened beverage tax seems interesting. Any further movement on that?
Well, I know that they're, like, even within the Northwest territories, they're looking at implementing it at the territory level. So there are different jurisdictions looking at implementing. And I think what the feeling was is looking at maybe the effectiveness of a federal sugar sweetened beverage tax as opposed to individual ones, and that might kind of have just a lot more impact at that level. So I don't know of any further developments on that other than there have been different jurisdictions. Was it the City of Montreal as well that did a similar, I think they did a similar request to the federal government as well as St. Albert. So there's different places that have kind of put forward their support for it. And yeah, I think over time it'll just gain momentum, and it takes time for all the evidence to come in and people to consider it, kind of like you're saying, this policy readiness.
Yeah.
Well, it just takes time for that, and eventually just seeing the benefits of it.
And you guys don't know, like, there hasn't been any bills tabled at a provincial or federal level for this that you've heard of?
No, I don't think so. No, there hasn't yet.
Yeah, I haven't either. I feel like I would have heard a lot about it if it had been. And unfortunately, I mean, I know other cities in the States, I think New York notably.
Yeah, Berkeley.
Yeah.
There's quite a few countries around the world who are starting to implement it, so it's gaining momentum.
Yeah.
So we hope to see that here as well.
Yeah. Unfortunately, municipalities can't levy new taxes, so you have to advocate to the province and feds on that one. Where can we get the stats from the sugar sweetened beverages tax proposal, the number of diabetic cases, cancer, et cetera, that you were mentioning?
Yes, that is from the Waterloo report. I believe it's on the Alberta Policy Coalition for Chronic Disease Prevention website.
Okay.
And it would be under resources. You will see that study, and it was actually commissioned by the coalition. So it's readily available with all those statistics, and they generated a model to show just the preventative potential that it could have, so it was quite well done.
Great. Yeah, I can include a link to that too in our digest article for anyone who's interested on those stats. Okay, we'll just wait a couple more minutes in case any of you have any sudden last-minute brainwaves here that something you'd like to chat about.
And I'm kind of interested in going back to that slide on those quick wins, and even thinking of just the quick wins. And is this something that you think your municipality is ready for, or could move towards, even to some of these?
Tina should say she has to get to her next meeting, but thank you. It was very helpful. Yeah, no, thanks for joining us and for having some questions and comments. Okay, I guess crickets. So you guys left, your emails are in this, right?
No. We usually do. Sorry about that.
Okay, let me look at.
We actually didn't put it at the end. First, we usually do.
Oh, okay. Yeah, it's not there. Okay. So yeah, if you guys think of anything, if you have any questions about the report card series, I'll put my email as well as Krista and Michelle's emails in the digest article, so you can contact us. If you're just looking for a tool or a resource and you're not sure where to find it, it doesn't seem to be on the hub. Yeah, feel free to get in touch. If you're interested in this topic, like I said, the Alberta Policy Coalition and the U of A really did a great job pulling together all of those resources. So those are on our website. So there's so much good information there if this is something that you want to get started on in your own community. And I would just like to thank Krista and Michelle for being here today to talk about the Nutrition Report Card and opportunities for you guys to promote healthy eating in your municipality. And thank you to all of you on the line for joining us. If you know anyone who wanted to attend the webinar but couldn't, as I said before, we'll be sending out a link to the recording, a copy of the slides, my email, our presenters' emails, and a link to the Waterloo report. That'll go out in the AUMA and RMA weekly newsletters probably next week, so you can feel free to pass those links along. And then we have a few upcoming events that I'll just show you. So of note, our regular Spring Municipal Leaders Caucus will be March 27th to 28th in Edmonton. We should have an agenda out for that at the end of January. And if you want more information or if you want to register for any of these events, just visit our events web pages, and those are at the bottom there. So we look forward to talking to you again at our next webinar, and have a great day.